If you've ever suffered from low back pain and sciatica, that nasty pain that kind of goes from your back into your butt, down your leg, if you've answered yes that you're a sufferer of sciatica, then this is the video for you. Today, we're going to tackle sciatica, and I'm going to give you 3 effective exercises, easy to do at home. You can start today to start getting relief immediately. My name is Mauro Burnett, physical therapist and owner of Australian Physiotherapy Specialist Physical Therapy Center located here in Jacksonville, Florida. Over my 23-year career, I've been able to help thousands of patients recover from low back pain, disc disorders, and sciatica. So in today's video, we're going to talk about 3 effective exercises that you can do immediately to start getting some relief. But before we get into the 3 exercises, let's take a few moments just to discuss the definition of sciatica. Sciatica, if we looked up on Google or if you found it in a medical book, oftentimes you're going to find a definition like this. Essentially, it's pain that follows the sciatic nerve. That's the nerve that exits the back, goes down your hip, into your buttocks, and down your leg. So any pain along that sciatic nerve, we could call that sciatica. Oftentimes, what's causing the pain down the leg would be a herniated disc, bulging disc, could be stenosis, it could be a bone spur in the back that's causing pressure on these spinal nerves. Pressure on the spinal nerve causes this terrible pain that goes down the leg. It could be tingling, it could be numb. Eventually, it could be really bad where the nerve is being fully compressed. We would call that radiculopathy. That's where you might see weakness in the leg. Well, let's get into exercise number 1. All right, for our first exercise, we're going to do a correction to what's called a shift deformity. This is a scenario. Maybe you have a bulging disc on the left side, pain's going down the left leg, and oftentimes it might shift you to the side. So this would be a shift deformity to the right. Before we can do any therapy at all, we have to address the shift deformity and we have to correct it. So here's a fantastic technique that we can try. I've got my shift deformity, pain's going down my leg. I come over to a wall. I'm going to place my shoulder against the wall. I can move my feet a little bit off the wall. My hand's going to go on the hip, and then I'm going to slowly slide my right hip towards the wall. At first, you might experience some discomfort. If you do, just touch your discomfort and then back off. You might have to do this 5 or 10 times. But what we're trying to achieve is by the time you're finished doing this shift correction, when you get back off the wall, you should be a little less shifted to the right and you should have a little less pain going down the right, or in this case, the left leg. When you get against the wall, here's a good detail. If you go to shift and it's just too painful, you can play around with putting your back in a little bit of extension, like backward bend a little bit, and then try it again. Oftentimes, if you find the sweet spot, it's a little more doable and you get faster relief. Sometimes it might be a little bit bending forward when you try it. But you could play around with it. It's called finding the slot. Check a little bit of extension, check a little bit of flexion, but try it. Just kiss your discomfort and come back. Maybe 5 or 10 times. When you're finished, reassess. If you look in the mirror, you notice you're a little more upright, less pain in the leg. Great, successful treatment. You could easily do this every couple hours during your first or second day of having severe sciatica. Now let's get into exercise number 2. All right, for exercise number 2, this was an exercise invented by a famous therapist from New Zealand by the name of Robin McKenzie. This is kind of how it goes. Imagine you're standing and you flex forward, bending forward, maybe put your shoes on, put your socks on, and you notice, wow, that really makes my sciatica worse. It's driving the pain down my leg. But then you notice maybe when you're a little more upright, or maybe even kind of backward bending a little bit, that actually gives you some relief or is not as bad as bending forward. If you came into a physical therapy clinic, we would do a little bit of an assessment. I'd ask you to bend forward 4 or 5 times. We'd see how that makes your leg feel. How does it feel? It feels worse. Standing tall, hold on to your hips, lean back, do that 5 times. How does that feel? That actually isn't as bad. Maybe even makes my sciatica feel a little better. If that's you, this is your exercise. This is how it goes. Step 1, lying on my stomach. I'm not going to go completely on my stomach so that I don't mess up the microphone here, but you lie completely on your stomach, arms down by your side, and then what you would do is you would rest in this position for about 2 or 3 minutes. You take some deep breaths, let your lower back relax, let your stomach kind of sag into the table, make sure that your leg pain, your sciatica is stable. Okay, 2 or 3 minutes go by, relaxing, breathing. Now you prop onto your elbows, our second phase of the exercise. Same thing, relax your back, relax your stomach, let it kind of sag towards the table, let your body get prepared for extension. So you hold that for 2 or 3 minutes, let it sag. Okay, great. Now you've done exercise number 1 for 3 minutes. You've done exercise 2 for 3 minutes. Here comes the final part. I put my hand by my side and I start to do this half push-up. It's very important that my lower half does not come off the table. You do this right in your bed. You do this 10 times if you can, maybe going a little bit higher each time that you do it. And by the time you're done doing this 10 times, you would stand back up, take a few steps, and assess, how does your leg feel? If it feels markedly better, guess what? You have a fantastic exercise that you can do at home. Mr. McKenzie would say, hey, every 2 hours, if it's Saturday, you just hurt your leg, hurt your back, do this every 2 hours for the next 24, 48 hours and see how you respond to it. If it's really giving you relief, this could be a great exercise that you can use at home for getting rid of some sciatica. Now let's get into our final exercise, exercise number 3. For our final exercise, you've done exercise number 1, you corrected your lateral shift. You've done exercise number 2, and now maybe you have a little bit less pain going down the leg, but maybe you still have some pain either in the outer leg, the buttock, or possibly going down into the lower leg. Here's another option that we can do. Famous therapist by the name of Jeff Maitland created this exercise years ago, and he called it the Maitland slump test. But we're going to use this slump test as a nerve gliding technique. It kind of goes like this. Let's say my left leg is the leg that has the symptoms, the pain down the leg, the sciatica. I put my hands behind my back, kind of hold my hands. I'm going to slump at the lower back, bring my head down, and then what I'm going to do is straighten my knee and then bring my foot up and then bend my knee and point my toe back down. So I straighten my knee, bring my foot up, and then at the same time, I'm going to look up, point my foot down, bend my knee, lift up. So you could think of it like if you were kicking football, an American football, right? And then you kick and then you look up to see if you made the goal and you come back down. It's important that when your head is down, your foot's down, and when your knee starts to extend, your foot starts to come up, toes come up, then you look up. That way you put pressure on the nerve on one end of the system, but you take pressure off the nerve at the other end of the system. What you wouldn't want to do is have the head and down, which stretches your sciatic nerve, and then pull your foot up at the same time, because then you're going to pull your nerve in both directions at the same time. It's not going to like that. The way this works is you only do what's comfortable. You don't want to stretch a nerve. You glide it to the point of comfort, and then you come back. But you don't want to go to the point where you're feeling pain every time you do it. That's crucial. If you do that, it can make it worse. You straighten your knee, look up, keep it 100% pain-free. If you kind of figure out, okay, I can go this far comfortably, but not any further, that's what you would do. You would practice this to where you could get 10 or 20 reps. You could easily do this 2 or 3 times a day. When you're finished, stand and walk around and see how your leg feels. Oftentimes, you'll have immediate relief from your sciatic leg pain. Well, there we go, guys. 3 exercises to give fast relief from sciatica pain. You know what to do. Don't forget to like, share, and comment on the video. And remember, you can subscribe to our channel to get more videos like this in the future on physical therapy related tips. It's goodbye for now, and we'll see you next time on Physio Tips with Mauro.